Hi everybody, this is Dr. Hinson. I wanted to take a moment to make this little video to answer some of the questions I've received via Facebook messages and personal emails from people who are asking me about what I do and exactly how I do it. So I was going to take this opportunity to kind of give you a brief explanation and hopefully I can make it as clear as possible. Should any of you have any additional questions about specific conditions and or need more clarification about what things I talk about in this video, don't hesitate to Facebook message me. You can also like my Facebook page at Dr. Tori Hinson, and I'll be more than happy to answer any of the questions that you have. But in essence, what I do is I look at the body differently than most doctors, in the sense that I look at a person when they come to my office, and I have patients come to my office with all kinds of different conditions, everything from pain in some body part to illnesses, disease issues, things like that. And one of the biggest things I tell people all the time is I don't treat conditions, I treat the people who have them. And what I mean by that is when you look at any kind of health problem, there is a structural cause, and a mental and emotional cause, and or a biochemical cause. So what I try to explain to patients is when I evaluate them, I evaluate their structure, we help balance out their emotions, we also help to make sure their body chemistry is functioning properly. So someone may come in for a variety of different conditions, everything from calf pain to headaches to endocrine and hormonal imbalances. I see patients with sports injuries, people who are looking to just improve their performance in their career or their job. And so this treatment allows us to evaluate that person individually and not just provide the same type of treatment over and over again every time they come in. But most of my patients always tell me that each visit was different, and that's because they're different. After we work with them and do some stuff with them, they are a different person. Certain things have been fixed, and then what we're trying to do is, in essence, take them to another level. And so what I do is, in order to evaluate someone structurally, chemically, and emotionally, we utilize manual muscle testing to do that. So we isolate and test all the different muscles of the body. Every muscle in the body is related to an organ or a gland. Every muscle in the body is also related to acupuncture meridians. So, muscle testing is a fabulous diagnostic tool and a fabulous biofeedback system. It gives us an instantaneous response as to whether or not a particular therapy was successful or which a therapy is appropriate for that person and their needs. So, for example, a person may come in with stomach issues, digestive disturbances, and so we can evaluate their entire digestive system and find out where the weak link is in their digestion, where the weak link is in their life as far as mental and emotional stress, and also where the weak link is in their structure. And so, it's not uncommon for people, say, with a stomach problem to have neck issues, pain in between their shoulder blades, possibly shoulder pain, and there's even bones in the feet that relate to the to the stomach. So what we're trying to do is, in essence, balance these people and figure out exactly what needs to be done for them. Do they need nutrients? Do they just need structural corrections through chiropractic adjustments? Are there certain emotional stresses that we use specific techniques to help clear? It's all dependent upon the person and what their needs are. And so we use manual muscle testing in conjunction with standard diagnostic tools such as lab work or x-rays or MRIs if needs be, in order to help paint a complete health picture of that person and their problems. So if you have any particular conditions you'd like me to address, I will be happy to make videos that talk about those different conditions and kind of show you how my approach would help those particular situations and those conditions. Anyway, I look forward to hearing from all of you, and we'll talk to you next time.